In the fight against breast cancer, early detection means hope for millions of women. Hologic brings a powerful imaging tool to help in that struggle. We call it selwnia. Digital imaging can greatly improve the process of breast cancer detection. But to do that, the images have to meet the most uncompromising standards of quality. Because when it comes to saving lives, second best isn't good enough. Selwnia delivers truly exceptional image clarity by using direct capture technology. To see the difference between indirect and direct capture, just look at these two digital images of the same breast. Why is the image on the right so much clearer? Because it's a true digital picture. Some digital detectors are partly photographic. They convert X-rays into visible light before recording them. But by nature, a light impulse will diffuse within the scintillator, so its profile on the pixel array always has a slight but significant blur. Selwnia's detector works on a different principle. First, the X-rays pass through a high-transmission cellular grid. The cell walls absorb rays that are not relevant to the image. Filtering out radiation scatter greatly improves contrast without an increase in dose. The X-ray then strikes an amorphous selenium detector in an electric field. Instead of light, the ray converts to an electric charge, which can only move in a straight line to a pixel electrode. With no lateral diffusion, the image is truly digital and extremely sharp. And here's the result. For the expert viewing the image, seeing is knowing. Selwnia is founded on a truly outstanding technology. But to really make a positive difference, the system also has to be flexible enough to handle real-world clinical situations as they arise. Selwnia uses a single detector large enough to image almost any breast. This reduces the need for multiple exposures, and you never have to change detectors. A smart compression paddle system expedites the session. When the mammographer sets the paddle position, the collimator and exposure sensor conform automatically to the selected view. The paddle adjusts itself to the natural contour of the breast, giving more uniform tissue compression for better image quality. Selwnia's acquisition workstation, with its intuitive user interface, streamlines recurring tasks like accurate exposure setting, image capture, positioning assessment, and file management. It's easy to recall recent prior exams for reference. The mammographer can send or print diagnostic quality images without ever leaving her patient. Images and annotations flow freely between mammographer and radiologist, even during the exam. If the radiologist needs another view of a particular feature, the turnaround time is minimal. They can work in concert from the same case study, ensuring a coherent workflow and maximizing patient throughput. Selwnia is fully DICOM compliant, so its images work with standard archive storage and hard copy printers. With Selwnia's soft copy diagnostic workstation, the radiologist can study images with total interactive ease. You can quickly set and instantly recall your personal hanging protocol. Zoom and navigate intuitively. Roam at full resolution. Apply computer-aided diagnosis. Toggle to compare current and prior exams from different years. And mark, measure, and annotate suspicious features for further attention. Selwnia automatically optimizes contrast across a mammogram, making all tissue clearly visible at a glance, from the chest wall right to the skin line. This degree of clarity is only made possible by true digital imaging. The workstation can expand to include multimodal viewing capability. Now the radiologist can study a mammogram right alongside the patient's MRI, PET, biopsy, or breast ultrasound images, reducing footsteps, saving time. In fact, everything about selwnia is engineered to maximize your time spent seeing and understanding. Selwnia becomes a personal tool, supporting your expertise rather than slowing you down. A digital image is weightless. It can be anywhere, anytime. We can capture it quickly, move it fluidly, and manage it accurately. This extends both the power and the reach of your care. Selwnia is an important tool to help the radiologist see more clearly and act more swiftly, to help save more lives.